All right, so good morning, everyone, almost good afternoon. We are about to start a very interesting topic, which we've been talking about for the past almost hour backstage, and a lot of interesting information. I would like to start with Mr. Dmitry. The concept of correlating health span with wealth span is a fascinating thing at the moment. So could you provide examples in which you can see the health tech integrate or intersect with the fintech or wealth tech?
Yeah, sure. So several examples.
Yeah.
UBS Bank, which is one of the biggest private wealth banks in the world, based in Switzerland. So they made survey among their clients, ultra net worth individuals, whether they are expecting to live more than 100 years. And depending on different countries, but for example, in Germany, 70% of the clients answered that they are planning to live 100 years. UBS Bank created a centenarian club among their clients and started to design structured financial products for the clients with extra long longevity of financial products. Another example, Barclays Bank in London. So they, within their desk for wealthy clients, again, they created a longevity theme. So it's like there's, investment products adjusted to people who are actually planning to live longer. So extended health span, extended lifespan should be integrated, adjusted, synchronized with extended wealth span. In other words, health tech should be integrated with wealth tech or fintech, longevity fintech. One more example, this is my banking card, my personal bank card, this is MasterCard, but this is longevity card.
Yeah.
So this card integrated with marketplace, it's in the UK. Health tech marketplace, so with this card I can get discounts for their services or vendors which are provided services, related to healthy lifestyle.
Mm-hmm. So if we move more, do we get to buy more?
Yes.
Yeah? All right. Okay, so how do you think would this have more of a direct effect on the financial planning, whether it's individual or for like the entire economy?
If we'll consider stock exchanges,
okay.
So there I do know about several derivative exchanges which are now got licenses during this year, but we are planning to start actual trading in the next year in the US, in Chicago in particular. So they will be issuing, let's say, providing a marketplace for traders who will be making structured financial products, derivatives, hedging the health tech market of United States, which is volume of transactions of healthcare of US annually, $5 trillion per year.
Mm-hmm.
On global scale, I don't know, there is no kind of actual, methodology how to assess global trading volume of financial products related to healthcare, but we are talking about tens of trillions per year. So in a sense, like opportunity for longevity financial industry, it's just like immense, unlimited.
Interesting. All right, we'll move to you, Dr. Ramzi.
Hi, everyone.
My question is about Mohamed bin Zayed University at the moment. How do you think you are utilizing artificial intelligence to benefit this subject and the effect of longevity and whatever you're implementing from that?
Of course, yes. Hi, everyone. First of all, in fact, we're coming from a very young university. We are only 4 years old. Yet, in fact, we have been very successful. It's a government-funded university, but today, in fact, we are ranked around number 13 in the CS ranking for AI, and this is a worldwide ranking. And we have the major universities in China and in the US in front of us, but we are number 1 or 2 if we remove, in fact, these two groups. So really, we have been working actively in the healthcare area, and we have a number of departments that are contributing to these advancements. The computer vision department that is looking after how to help, in fact, the computer to see like human. Actually, we have been really very active in developing solutions for helping diagnosis and reading images like MRI or CT scans or even ultrasound data to detect diseases, even in fact before the human can see them on the imagery. So we've been really active in this area. Another area where we have produced extensive results is around large language models. We know that we have today ChatGPT, Gemini, and many other large language models that are generic. But we are building purpose-built language model, especially in the healthcare area, where we are training, in fact, these models to be efficient in helping practitioners and helping doctors to use them as a tool to augment, in fact, their capabilities. So we have language models that are trained. You give them an X-ray, and the model will be able to give a diagnosis and help or support or provide advices on how to fix or what would be the next action for them. So we have these departments that are following the faculty studies, but also now we're really making a bold move by building an institute of public health, and the institute here is really bringing all the technologies, all the expertise together to help and address, in fact, the core mission that we have today and try to help advancing the healthcare. And obviously, one of the objective is to see how longevity can escape velocity.
Yeah. Well, to be honest, I'm really looking forward to a lot of these studies because from a dentist perspective, as a medical practitioner, this will narrow down our process of diagnosing the patient, all the differential diagnoses that you might get, all the prescriptions that sometimes are way too broad for what the problem is actually. So I think it will definitely help out with this. Okay, you told me some interesting details a while ago backstage about a project related to this. Can you give us a quick brief about what's going on?
Of course.
Yeah.
So today we're working on a project what we call the Human Phenotype Project, and this is something that we are putting in place in collaboration with Saha and Pure Health. This is really a breakthrough project and very promising. It is at the base a longitudinal study where we are taking cohorts, we call them cohorts, over 25 years. And we try, in fact, to follow these cohorts over the time to really capture not only genomic data, but also phenotype data, RNA sampling, blood tests, living behavior, sleeping behavior, many information about these people and following them over time. And obviously, some of these people, in fact, will get sick, and we'll be able to capture also these changes in their data. And so we will have, and this is a global project, not only limited to the UAE, a tremendous amount of data that will allow us really to break through, to improve, in fact, precision medicine, to improve, in fact, healthcare, and obviously longevity. So this is really, again, an amazing project that we are working on today.
Incredible. Thank you. All right. So a question to the both of you to wrap this up. As you know, in the UAE and Abu Dhabi, we always aim for the highest ranks. And what do you think would be an indicator for the UAE if they're going to be leading in the longevity medicine? And in general, what do you think that the private or the government sector can do to enhance this?
there are a lot of things which can be improved.
Yeah.
But going back to indicator, I'm attending multiple conferences in London in particular. I'm living in London, healthcare, health tech, AI in healthcare, etc., including longevity. But the highest quantity, density, and quality of conferences and activities related to longevity right now happening in UAE already.
True.
In Dubai, Abu Dhabi. So, for example, last time I was in May here in Abu Dhabi Global Healthcare Week, organized by Department of Health. That was one of the best conferences I ever attended at all. And the topic of longevity was very, very, substantially present there. Across all presentations, all panels. The same as happening right now at this conference. So the audience, which is right here, all the people who are gathered here, I think they are representing actually this agenda of longevity. So going back to your question, UAE just need to proceed to do what they're already doing on the topic of longevity, and that was the best possible scenario.
So we keep as we are. We keep going on track.
Yes, exactly.
Excellent. Doctor.
So a few things. I think already, the country is making the right choices in terms of strategy. The university is the unique university, for instance, specialized in AI. There's no other model, in fact, in the world, and this is bringing a lot of talent, both, in fact, from researchers, but also building the talents here. So this is an amazing achievement so far, and we need to continue. But also what we see, we need really to develop more the research institutions. Today, we have amazing people specialized in AI. We need to combine these capabilities with scientists so that we can achieve another breakthrough in this area. So research institutions, we need really this is the next thing to invest in, that will bring concrete solutions, that will bring solutions that can be applied to the real world. So this is one area. The second area of improvement, and I am sure that this is something that we can fix quickly, but it is here today, is that we don't have, in fact, a unified data model or data sharing model between the different Emirates. And this is something that we really need to fix as soon as possible. For my personal experience, in fact, I went to the hospital here in Abu Dhabi, and when I asked for my file to follow me to Dubai, that was not possible. So this is something that really we need, in fact, if we want to have this unified data, so that will help us also making better models and deliver better results.
Yeah, I totally agree. I think that's definitely one point that can be improved. I guess that's pretty much it. We appreciate your time, and hopefully within the next Forbes Healthcare Summit, we'll have more details and updates from you. So thank you all very much. Hope you enjoyed this, and thank you.
Thank you.